All right. Hey everybody, my name is Eric Chaconis, and I am the program director for our new physical therapy program at Bellin College. The purpose of this info session, what we're going to do tonight, really is go over the ins and outs of the program, describe the curriculum, talk a lot about the faculty, what we believe makes us different, and really just answer your questions and kind of dive deep into all things our new DPT program that is starting for the first time this fall. The first day of class is August 29th. I think I got it. So we're going to have an orientation the week before that, where people will come to campus and kind of get settled. But then, yeah, the first day of class is Monday, August 29th. And I'll talk about the schedule overall and the way the semesters break down and stuff like that as we go here. All right, so as today's modern doctor of physical therapy is certainly an expert in human movement and performance. I think what we're really trying to do with this program is be more than just the expert in rehab and the rehab provider, but also really getting into the field of prevention and health promotion, and in just practicing in so many different settings, right? So like most physical therapists go on to practice in outpatient orthopedic facility, hospitals, acute care hospitals, skilled nursing homes, treating patients in rehab centers, patients that have had spinal cord injuries or strokes and stuff like that. Our program is very grounded in musculoskeletal, so we have a really strong musculoskeletal element. We obviously all the different specialties are covered and well covered in the program, but Bellin Health is certainly a center of excellence when it comes to musculoskeletal care. And so them being kind of our big partner really does help a lot. We have a lot of fellowship trained orthopedic experts that are going to be part of our faculty. And then also preparing you for different practice settings. I think the big new area of practice that you're seeing more and more of is cash pay physical therapists that don't take insurance, that have a small office in a gym. So you're seeing lots of physical therapists working in different types of health facilities, fitness centers, and gyms. So certainly that's something that we want to foster and develop. Physical therapists that work for different sports teams and specialize in, college basketball, professional basketball, or the NFL. I've had students. I've been teaching in physical therapy education for about a dozen years. I mean, I have students in all 4 professional sports leagues. I always tell people, if that's what you want, like I have a guy that came to, he had a background in strength and conditioning. He had done an internship at University of Kentucky. So he had a little bit of sports strength and conditioning background, but his whole goal, he was a lifelong Detroit Pistons fan. His whole goal was to work for the Pistons someday. And if you work hard enough and you go out there and you're willing to, do what it takes, you can make that happen. And today he runs the whole rehab department for the Detroit Pistons. But he starts off in the G League, kind of cut his teeth, low salary, a couple years of experience there, and then you just work your way up. So whatever you want to do, I mean, this profession, that's the wonderful thing about it is you've got so many different areas of practice that you can kind of dive into. At Bellin College, we are primarily a healthcare focused college. So we've had a nursing program for well over 100 years. And Bellin College was started by Julius Bellin in the early 1900s. He's the one that founded Bellin Health. So this guy is a physician. He's got his hospital, Bellin Health, that he created. And then he creates this college to train nurses to work in his hospital. So that's how the college started. And it was just a nursing school for many, many years. I mean, for probably 80 years, it was just a nursing school. And then in recent years, brought on all these new programs, radiation therapy and ultrasonography, MRI, surgical assistant. And now, of course, we have a doctor of nurse practitioner degree that we offer. And then a whole physical therapy department now. So in 2017, we created this Doctor of Science in Physical Therapy, which is a post-professional degree. So if you get your DPT, but then you say, I really want to teach, I really want to do research, then the DSC degree is for you. So this is for practicing physical therapists who already went through school, already have a license. They want to go on to teach and do research. That program's had a lot of success. You can see that. If you go on our website and then you go in programs, academic programs, you can see our Doctor of Science program and all the publications that have come out of that program recently. So it's really exciting. And then the other way too, following us on Instagram, we're on Instagram and Facebook as Bellin College Physical Therapy. We post a lot of stuff about what our DSC program is doing on those social media channels. And then we also have an Orthopedic Manual Physical Therapy Fellowship program. So This is for physical therapists who want to just get better and want to specialize in orthopedic manual therapy. So it's an extra year or two of training after graduating from PT school to specialize. I did that back in 2007. I went on to do a fellowship because I wanted to just get better. And anyway, that we offer one of those as well. So for our DSC and our manual therapy fellowship, students are all over the country. Those are virtual programs. A lot of the content's delivered online for the classes. For fellowship, they got to go for weekend intensive seminars all over the country. For DSC, they just do research online through Bell and Health with all the health system data. So it's a lot of big data physical therapy research. And then DPT will be the newest program. So this will be the newest program that'll start this upcoming August. It's not the building you see here. That's our Eaton Road campus. It's kind of on the east side of Green Bay. About 10 minutes away from that is our new building that we just purchased that's going to house our DPT program. So we just needed more space, and you'll have a few things over here that you'll do, like anatomy and stuff like that. You'll go back to the main campus. They're close. But we're really excited about this new building because it's going to be ours. Like the downstairs, we have our own classroom, our own labs, our own offices, and all that. We share some classrooms upstairs, like lecture hall type classrooms, and then there's going to be some labs over there that we share. But we have our own space, which is pretty cool. This is our mission statement. And I'm not going to read the whole thing, but just highlight some of the key points. We really strive to create physical therapists that are going to be altruistic, that care more about the greater good, that care more about society and what we're going to do to advance society and to improve the health and well-being of society versus, our own personal agenda. And so, for us, it's all about we in the United States, the healthcare system is broken. We spend way too much money on things like low back pain. And it's because we have this physician first model where you hurt yourself, you go to a physician, you get an MRI or an X-ray, you go to a specialist. It's ridiculous that you don't see a physical therapist first, right? And so we believe we really can play a key role in improving the well-being of society and the financial well-being of society, because Medicare is going to go broke if we don't fix this. And I think one thing that Medicare needs is a direct access to a physical therapist type of model. So altruism, caring about the greater good, caring about our patients, caring about our community, that's what we're all about. And then clinical excellence. I mean, we're going to push you. I mean, that's the one thing about this program is it's going to be uncomfortable at times because we're going to push people. We want you to get outside of your comfort zone, to grow and to develop and push you, academically, as hard as you've ever been pushed. I mean, that's the way that you really become a strong clinician, right? Is to go through that process. And so that's going to be exciting. We want to see leaders graduate from our program. We want to see people that go on to run the state association, that go on to own a large private practice and make tons of money and, have their own business and lead in all these different areas, maybe be the CEO of a hospital. We need more physical therapists in the CEO of the hospital type of role. We need more physical therapists as politicians, as crazy as that sounds. Love they're talking about politics, but we need physical therapists in the state house and in the Senate to pass laws that help patients and that promote our profession and what we can do, right? It's kind of overrun by medical doctors, and that's not good. I mean, we got to step it up. So we're all about that. Lifelong learning, knowing that you're not going to be able to practice with the knowledge that you graduate with. So you graduate, and then 3 years later, all this new knowledge, all this new research comes out. If you're just doing the same thing we taught you in school, you're going to be outdated, right? You need to stay up with the current best evidence. And so our goal is really to make you a lifelong consumer of knowledge, a lifelong consumer of research, not just reading articles in the courses that you're taking to implement that in your practice, but reading those articles so you have that skill. So later in life, as new research comes out, you can digest it and implement it into your practice. Service is huge for us. There's a huge service element to our program. We're going to have a lot of different service activities. So that's giving back to the community. What can we do to make a healthier community? How can we go out into the community and help people? Well, there's certain populations of individuals that are underserved that we can help. And then service to the profession, right? So getting involved in the profession at a large scale. So like all of us faculty, we all serve in some capacity at the APTA or the American Academy of Manual Therapy. We serve in some capacity to the profession to help advance the profession. And then advocacy, going to the state house, letting the lawmakers know what our issues are. We're lucky in Wisconsin. We really have a pretty good practice act. Like when you graduate, you're going to be able to do pretty much everything that you want to do. In Wisconsin, a physical therapist can order x-rays. In Wisconsin, a physical therapist can dry needle. You can stick needles in people. You have full unfettered direct access. If somebody needs to come and see you off the street, they can see you. It's just sometimes insurance regulations don't pay for it. But legally, somebody can see you. It's not like some of these other states, like Texas. You can't see a physical therapist direct access Texas. You got to wait. You can only see them for one visit, and you got to wait. It's a huge pain. So anyway, we're good as far as state goes, but maybe the neighboring states, I don't really know about Illinois. Maybe there's work that needs to be done there. I mean, I think Iowa, my knowledge of Iowa has a really good practice act, but I don't know the details. And then obviously there's like national implications, right? Going to Washington, D.C. and advocating for changes to Medicare that can help our patients and help the profession. So just a reminder on lifelong learning. I personally have, had students say, I can't wait till I graduate so I never have to pick up another book again. I'm like, oh, like that is like painful to listen to. Like, you can't be that way, right? Like you're going to be obsolete in a couple years. You're not going to enjoy the profession. For me, I think I was a little burnt out. I graduated PT school 2005 and I was a new grad. So 2006, I'm like working. And I was a little bit burnt out. And I always kind of was like, there's got to be more to this. I felt like I was doing the same thing on every patient. And what I did really was I started really diving into the literature. And every month I had a friend that was a PT in another city. And every month we would get on the phone. We'd talk about whatever new research article came out in JOSPT. And that lit a spark in me and it really helped my career. So I just think that dedication to lifelong learning is what makes it fun, right? Because you're always like the latest and greatest, coolest, newest, neatest technique. You're implementing it in practice. Your patients like that. You feel like you're on the cutting edge. It makes it a lot more fun. So we're going to take one cohort per year. 34 students per cohort is going to be our max. So we're going to keep it small. We are so lucky. Bellin Health is a non-for-profit company. Bellin College is non-for-profit. We tell them what we want and they do it. So we say, hey, we want to keep this program small because we know with small numbers, we can really make the quality good and we don't have to worry about as many people to place on internship. We feel like 34 is the sweet spot. I've taught in programs that had 60 students per class. I don't mind that. It's probably a little on the big side. 34 is perfect. 20 would be a little too small. You wouldn't have enough people, enough different personalities and enough people to really, have a good culture. I feel like 34 is perfect. And then we'll have 15-week semesters. So 8 semesters long total. It'll end up being 2 years and 8 months. These are our currently employed faculty members. So I introduced myself. My expertise is musculoskeletal, and I'll teach the differential diagnosis course. So I do a lot of medical screening type of work, and then I teach imaging, diagnostic imaging, and research courses. John Weiss, who's our assistant program director, he has a background in sports actually, and he was with the health system for like 20 some years. But he recently, in the last probably decade, has specialized more in geriatrics. He's going to teach a variety of courses related to geriatrics and basic fundamental skills and exercise prescription, stuff like that. Amethyst Messer is our clin ed coordinator. She's amazing. I've never worked with such a great, incredible person. So we're really lucky to have her on the clin ed side of the house because she's just so on the ball and organized. She teaches a lot of the neuro courses, neuroscience, neuromuscular, but she's the one that will place you on your internship and coordinate all your internships. I'll talk about the internships and how those work here in a second. And then Mark Shepard, who also is the director of our fellowship program. He's a pain expert. He teaches the lifestyle medicine course. He has some expertise in recovery and sleep hygiene and stuff like that. And then pain science is his other big area of expertise. So I'll just briefly go over some of the courses that you're going to take and talk about the curriculum in general. So in your very first semester, this will be the fall, this upcoming fall of 22 or any fall. Same courses every year. We keep enrolling new cohorts every year. But, typical anatomy, pathophysiology are the first ones. Our anatomy is kind of cool because we have our own anatomy space in that new building that I talked about. So you'll get in there and you'll study the models. and you use our anatomage table, which you can see here on the bottom right, which is like a giant iPad basically, but you can look at cross sections of all the anatomy, spin it, zoom in. Like it's a good anatomy app. And then you'll go to the cadaver lab. So we partner with St. Norbert's, with the Medical College of Wisconsin, and that cadaver lab that they use, we're going to use it as well. So we'll go in there, we will dissect some cadavers, identify tissues on the cadaver, which is so valuable. I know it's kind of, personally for me, when I was looking to go to PT school, it was something I really wasn't looking forward to. I was kind of worried about it and stuff. But, I ended up teaching cadaver anatomy 7 or 8 years later after that. So it's funny what you get used to and what you end up starting to enjoy. There's no better experience. I'm a firm believer in cadaver anatomy making a better physical therapist. You need to touch the tissues. If you're learning about the knee, and there's nothing better than opening up the knee and seeing the ACL. And what happens to the ACL when we do this test for ACL laxity? I need to see the ACL and what it does to it. That is really an important part of cadaver anatomy. So that's that course. And then the red box around clinical fundamentals, every course I'll show you here that's a red box around is an integrated clinical experience course. What that means is you take this course, clinical fundamentals. You learn how to measure range of motion from the shoulder on Monday, right? Then on Thursday, you go out into the clinic and you see patients with a physical therapist and you practice measuring range of motion of the shoulder on the actual patient. So we believe in applied learning. We believe it's not good to be sitting in class all day long. You need to get out there into the clinic, try it on real life people. It cements it, it makes it fun, and the learning is better. So every semester in the first year of the program, you have one course that's like that. It's just like, and we know that from the literature too, right? Like you learn by doing. When you can physically do it, you learn it better. And we think this is something that we're so lucky we have that health system, and we have all these other health systems around us in Green Bay. So we have tons and tons of PT clinics that we're easily able to do this. And we pay those clinical instructors, we pay them to mentor you every Thursday. So every Thursday is the clinic day. You go out in the clinic, which would be really fun. Second semester, so this will be the spring semester starting in January. You got your human movement science, which is a biomechanics course. Biomechanics course, pretty cool. You're going to learn all sorts of different apps and how to use those apps to measure joint angles, to look at people squatting and deadlifting and running and jumping and stuff like that. Obviously, neuroscience is really a part 2 to anatomy, just focused on neuro. And then your musculoskeletal course. So the red box course, the ICE course in this second semester is Therapeutic Interventions 1, where you're learning the basics of exercise testing and prescription for rehab, but then you're going out into the clinic and applying that on real life patients again every Thursday. Same deal. It'll always be every Thursday. And then we have a lifestyle medicine course because we believe the future physical therapist doesn't just rehabilitate people, right? It's so much more than that. And you need to be able to educate people on proper nutrition, exercise, sleep, recovery, stress management. Like that's really how we're going to cure these problems that we have in our country, is by addressing those things, not just 4 sets of 10 of some exercise to cure your back pain, right? That's like not enough. You got to treat the whole person. And so it's one of those holistic kind of courses. We have a nutrition consultant, an expert, Patrick Berner's his name. He's a physical therapist that also is a RD, registered dietitian. So he's an expert in nutrition and rehab. And he's going to be coming into 4 different courses to teach 2 weeks out of 4 courses, all things nutrition. So pathophysiology has a nutrition element to it. This lifestyle medicine course has a nutrition element to it. Strength and conditioning 2, which you'll see in this semester, that has a nutrition element to it. We're talking about nutrition more in the sports population, and then geriatrics, because nutrition is really important in geriatrics as well, right? We have a lot of nutritional deficiencies as we age, and so that course hits on that stuff as well. We're all about modern day strength and conditioning. So, using the deadlift in physical therapy practice, how to use the squat in physical therapy practice, how to use all these traditional strength and conditioning principles that for some reason weren't a part of our profession for many, many years and now have become more in vogue. But I mean, I created a continuing education course for physical therapists back in 2010, where I went around the country and I would teach people modern day strength and conditioning principles as it pertains to rehab. And actually that course is still taught today, and I go and I do it every now and then. But anyway, it's such a area of weakness in our profession. Physical therapists do not know how to really dose exercise properly, and that's the course where we're going to make sure that you're good to go with that. Take a spine course, neuro courses where you're learning all about spinal cord injuries and strokes. Medical screening, super important. How do you know when somebody comes to your clinic, how do you know they don't have lung cancer? How do you know it's not some type of GI issue, right? So screening those other systems is what that course is all about. And then a little bit of business. Business is important. We don't have really enough time to teach you about business in physical therapy school. You got to learn how to become a physical therapist. But our profession suffers from a lack of entrepreneurs, a lack of business people who are able to go out there and create their own destiny. And that course just give you a little taste, right? A little intro, a little taste of that world is super important. So this semester, now you've been in the program for a year. You've done a full year, and you're back a year later in the fall again. And now what you're going to do is you're just going to take these 4 courses, which are all pretty self-explanatory, and you're going to take them over the course of like 8 weeks. And then for about 6 weeks, you're going to go out on an internship, your first internship. So this will be full-time in the clinic, 40 hours a week. You can, like, if you want to go back home, you say, I want to do this internship back over, where I'm from, then that can happen. We could try and get a contract with a site over there. That's less likely than one of the sites we have that's closer to Green Bay. So more than likely you do one closer to Green Bay, but you also might need to travel a little bit. If you want to travel far, like we have sites all up and down the East Coast. We've got some in Maryland, Connecticut, the Northeast, Florida, Georgia. I even have a friend in the Virgin Islands. So he's got 3 clinics in the Virgin Islands, and he's going to take our students. So if you want to, that's a lot of money, but if you want to live in the Virgin Islands for a little while and go snorkeling after work and stuff like that, that's always an option too. And then you're back for another semester. So what's cool about this program, you go out on internship, then you come back to campus for a whole semester, learning again, back into the classroom, diving into all this material. Pretty self-explanatory here. And then you're back out there in the clinic again for another 12 weeks in one of these internships. That's Titletown, our Bellin Health Clinic, Titletown Clinic right next to Lambeau. We've got all these other entities, all these other organizations that we contract with for internship sites. Then you're back into the classroom again for another 15 weeks. And then you go back out one last time for a final internship. So you're never... I personally, we don't love back-to-back internships because then it's just like you're working, and it's kind of like after a while it becomes just like you're just working, right? And it's nice to get back into the books, learn more, go back out, try it out, come back, learn more, go back out, try it out again. So logistically, there's a little bit of back and forth, but I think from a learning standpoint and your own professional development, it's really beneficial. Well, we're lucky here at Bellin. So this is So sonography, if you were to tear a tendon or have a tendonitis or a ligament sprain and you lived in Europe, you would not get an MRI. You would get an ultrasound. You would go to a provider who specializes in sonography, and they would just scan you right then and there. It's like 10% of the price of an MRI, and it takes half the time, and you don't deal with the whole claustrophobia of being in a tube and all that. So anyway, physical therapists in the United States do specialize in sonography, and some of them do it. It's just not as prevalent as it is in Europe. But we're really lucky. We have a sonography program at Bellin. So we get all these really nice sonography machines that we can use, right? So and you'll be exposed to those. You'll get a little bit of a taste. If you wanted to specialize in that, you'd need to do stuff after school. You'd want to go and take more courses and stuff after you graduate. But at least it gives you a little taste of it, what it's like. And we're going to teach you how to scan a shoulder, how to scan a knee, basic stuff. It's just, it's a very much a user-dependent type of modality where you really got to learn it well and take multiple courses over time. But anyway, that'll be part of our imaging course there in our second to last semester. Advocacy is going to be something we're going to infuse through the whole entire program. We are not cool with sitting back and letting things be the way they are, the status quo. We really want to stand up and be active and promote the profession and advance the profession. And so that's a big part of what we're going to do. And then you're going to have a portfolio that you're going to develop as you're a student throughout the whole time. And it's going to be a part of your kind of graduation, right? A big portfolio that you'll submit at the end of it all. That'll really show all the things that you were involved in, all the things you accomplished as part of your DPT degree. We are at 106 credits, $800 per credit. The total is $84,800. There's fees on top of that, so it comes out to like 87 grand or something when it all said and done. But we're very proud that we're closer to the price of a state school. We're by far the least expensive private school in the state of Wisconsin. We're actually one of the least expensive private schools nationwide. We're really lucky that we're a nonprofit and we're able to tell them we don't want to, we got to keep tuition low because we don't want to cripple students with debt. One of the greatest problems, and I think the thing that you really need to analyze is like the financial side of the house. How much money do I need to take out in loans? How long is it going to take me to repay those loans? Right? What's the financial makeup of this whole thing for me? Because, we're on the verge in the physical therapy profession of having what it costs to train a physical therapist and what our tuition burden is so far excessive to what you make in your first year out at school. So the old economic rule was always don't take out more student loans that should not exceed your annual gross salary your first year out of school. We've already broken that rule in our profession, right? Most physical therapists make $75K a year out of school, but 84 grand, that's one of the cheaper schools. Maybe you find a state school that's 50 grand, you can beat that rule, but it's hard on top of your undergrad loans as well, right? So most physical therapists violate that rule, but that's something you do want to be mindful of and make sure that you're on top of it from a financial perspective. You can make 100 grand a year out of school, but those jobs usually are a little tricky, right? Travel, or you got to go over the country, or work in an area that's in really, really hard to hire area where nobody really wants to work. Like those jobs pay a little better, but still, I'd plan on making like 75 grand a year, more or less, is probably usually the average salary for a PT. We have a free application. We're not on PT Cast right now, but we will be here shortly. Come July, we'll be in PT Cast, the physical therapy centralized application service. But right now, we're a free application on our website right there. These are our undergrad requirements for admission. So we require, obviously, a bachelor's degree. These are our recommendations for GPA and then GRE scores. Usually I tell people 295 is a really good GRE score. That's where you want to be. If you're below 295, you might consider retaking it again to try and get it above 295. A 290, a 292, a 293 could be okay if you're really strong in a lot of other areas, high GPA, have other parts of your application. I mean, we look at other things. So for example, co-curricular activities, sports in college, leadership roles, service, involvement in the community service, observation hours, all that matters in the application. We look at all that, and we very much look at your written statement. We read that in great detail. We want to hear your story. If it's well written and it's a good story, a compelling story, like your reasons for why you want to do this make sense, that does sit well as well. And then we do require 2 references, like faculty or somebody you worked with, type of thing. Here's all the prereqs. People often ask, so for the biology, you can substitute one biology with like an exercise physiology course. So if you have one biology with lab, but then you don't have a second biology, but you do have an exercise physiology course, that's good. That could take the place of that second biology. And then all the others are pretty self-explanatory. So this is really old. I haven't done this in a while. The new deadlines. Let me see. Can I fix this right now? We actually are still taking applications now. So we had a priority for we had an initial group that applied back in November. We had another group that then applied in March. And now we have a third group, and we really don't have a deadline for you. So honestly, if you were to say, hey, I'm not ready yet, I can't submit my application till June, that's okay. You may still have an opportunity to come in at June. We might still have a seat for you in June. And then what we do in that case is we just do an interview pretty shortly after you apply. So you apply. If you meet the criteria, we'll invite you to interview. It'll be a virtual interview. We'll invite you then to come to campus, to see campus, to meet everybody, and then you could start. So we're really quick. We pride ourselves on how fast we are and how just efficient we are with the application process to make it as painless as possible for people. We really have to disclose our current status with our accrediting body. That's really important. So we're a brand new program. So anytime you have a brand new program, you have new accreditation. And so for us, we have our CAPTE. We've submitted all of our documents to CAPTE, which is the accrediting body that governs physical therapy education. our visit for them is next week. So we're pretty pumped about that. Next week, Monday, Tuesday, Wednesday, we're going to have Cappy with us for 3 days straight to go over all the ins and outs of the program. Then the commission will vote on our program if it gets granted or not in July. We anticipate that we will get accredited in July, and then we'll be allowed to start students then in August, our first cohort in August. Then what CAPI does is they kind of monitor you. You're sort of in a monitoring phase for that whole first group as they go through. And then when that group graduates, passes boards, CAPI comes back, evaluates you a final time, make sure everybody passes boards, does good, and then they grant you your full candidacy accreditation status. So we have such a strong program, such a strong team. We don't anticipate any problems with that. If we were to have a problem, it would delay it. It would delay that August start date. But if you were to be admitted, start in August, and then we were to lose accreditation status for some reason later on, you would still be okay. You would still be able to graduate, take boards. What CAPI does is if you start a new program and they get accredited, and for some reason that program does not maintain accreditation or they lose their initial accreditation a year or 2 years later, the students in that program still get to take boards and become licensed physical therapists. So the risk, there isn't a ton of risk, I guess I should say, in starting a program. There's some risk because it is a brand new program, and there are hiccups along the way certainly, but it's pretty minimal risk overall. So that's my contact info right there. Feel free, email or call anytime. Specific questions about prereqs and GRE scores and application type questions can go to Amanda McCullough, our Director of Admissions. So thank you very much and have a great night.